Sponsored by the Carpal RX. Carpal tunnel syndrome is a condition that causes hand pain, wrist pain, and also causes tingling, burning, and numbness in the fingers. The condition is caused by a problem deep within the wrist, inside an area known as the carpal tunnel. All tendons, here shown in white, are surrounded by a sheath that's fluid-filled. At times, this sheath tends to swell, and that swelling pushes on the median nerve, here shown in yellow. When the tendons push on the nerve, it causes irritation of the nerve, and that results in the pain and other symptoms of carpal tunnel syndrome. So what do you do with your hands to cause this problem with your tendons? The National Institutes of Health and OSHA have identified occupations that are at high risk for producing hand pain and carpal tunnel syndrome. Not surprisingly, these jobs are those that require extensive use of your hands, like secretarial work and clerical work, often at a keyboard, and this includes medical and legal transcriptionists, or those who often use writing instruments like pens and pencils. Those who work in the electronics assembly business are also at high risk, as are those who use power tools a great deal, especially those tools that are vibrating tools. Jackhammer operators are at especially high risk. Those who sew and knit a great deal are also at high risk, as are graphic designers and computer programmers, musicians, especially keyboard players and guitar players, heavy machinery operators, woodworkers and carpenters, and especially those carpenters who work outside. Lumberjacks and lumber handlers are also at high risk, as are auto mechanics, workers in assembly lines, locksmiths, butchers and meat processors, especially in the poultry industry, garment workers, hairdressers and hairstylists, dental hygienists, massage therapists, radiologists, diagnostic ultrasound technicians, and grocery and department store cashiers. So what's the most effective method to get rid of hand pain and carpal tunnel syndrome? It's deep tissue massage therapy. But you must apply this therapy every day for 2 to 4 weeks. Visiting a therapist only once a week for massage therapy is worthless. So how do you get this effective deep tissue massage daily without visiting a therapist daily? The answer is the Carpal RX. If you have carpal tunnel syndrome, then you owe it to yourself to try this remarkable product and take advantage of the 60-day free trial offer with every Carpal RX. If the Carpal RX doesn't relieve your symptoms, or if you just don't like it for any reason, return it for a full refund, including all of your shipping costs. The Carpal RX was specifically designed to treat the wrist and forearm. It works just like a therapist's fingers that are treating you for carpal tunnel syndrome, except it treats you every day and at a fraction of the cost of a therapist. The Carpal RX automatically produces the same motions that a therapist uses to relieve pain and other symptoms. And it's so simple to use. Just plug it in, slide it on, and strap it in. Then relax. The Carpal RX will do the rest. The Carpal RX always has a 60-day free trial, so if you're not completely satisfied with your results, return it for a 100% refund, including all your shipping costs. The Carpal RX is guaranteed to permanently and easily get rid of carpal tunnel syndrome, as well as wrist tendonitis and repetitive strain injury. Visit the Carpal RX at carpalrx.com.